Hello everyone, good morning, good night, whatever time it is. So again, I am off from work. I'm heading home. I just worked a 12-hour night shift. I'm like super tired. I know in the last video, or the video that I did, the story about how I met my husband, I said that I would talk about why I'm scared to get pregnant again, and a few of you said that you would like to hear that story. So this story is very sensitive. It's actually our testimony, or my testimony, because I almost died, and it was a very complicated, not pregnancy, because it all happened afterwards. So let me start off by talking about the pregnancy. So you guys have seen our daughter Ariel. She's now 8. So my pregnancy was planned. We knew exactly when I ovulated, when she conceived. Like, we knew exactly how in the day and what things happened. We knew exactly. The pregnancy was perfect. I didn't have any cravings. I gained, the whole pregnancy, I gained, I think, 20 pounds or something like that. I didn't have any morning sickness. I think the only thing I had towards the end was my legs were swollen, but that was about it. I worked all the way up until, I think, a few days before I had to deliver my due date. And of course I was doing ultrasound. So the whole pregnancy was just like perfect. I was due on the 28th, and come the 28th, I'm ready. I did my hair, and I'm like waiting for, I always see it in the movies where the ladies are laying on the bed, and you have your legs propped up on your husband, and your water break, and you're like, oh my god, my water broke. So I had that in my head, thinking, okay, that's what's gonna happen. My water's gonna just break, and Chris is gonna get nervous to find my door, to find my bag, to get my stuff ready for the hospital. Well, no, that didn't happen. My water didn't break. I didn't feel any kind of pain, no contractions, nothing. So I went in. I had an appointment that day. The day that I was due, I had an appointment. Obviously, I was due. And I went in, and they checked me. The baby was doing fine. No contraction, no Braxton Hicks. None of that. They did an ultrasound, and when they did the ultrasound, it showed that I didn't have any fluid around the baby. I think it was like a few millimeters of fluid that I had. So even though I wasn't having any pain, they had to I had to stay in the hospital. So that was the 28th. The whole process started off, I think that night that they started to give me the medicine to induce me. They were inducing me, nothing, no change. My cervix was not dilated at all. No pain, no contraction, nothing. So fast forward to the 29th, or the 29th. Still nothing. At this point, they didn't want to check my cervix too much because that would increase the risk of infection. So they had to just kind of monitor me and see if I was having contractions, which it took a long time for me to have any kind of little contraction to say, okay, I'm going into labor. Finally, on the 30th, I started feeling some kind of, or they start seeing some kind of contraction on the monitor, and they're like, okay, it's time for you to get the epidural because your cervix is now dilated, and it can, you know, once it dilates to, I think, 5, it gets faster, it opens up faster. So they gave me the epidural. I couldn't feel, after they gave me the epidural, I couldn't feel one side of my leg, but I could feel everything on the other side. So they were like, that's not normal. That means that it's only going to one side. So they had to come and adjust it. So mind you, this epidural is this big needle in my back, and it hurts. So they're wiggling it around and moving around, and the doctor came in to see if it was working. I was so mad because he brought like a pack of ice and he was rubbing it on my leg, and he was like, can you feel this? I'm like, yes. Can you feel this? I'm like, no. Like, can you feel this? So some areas of my leg, on one side I could feel the ice, and then some side was numb. So I was like, it's not working because I shouldn't be feeling it at all. And he was getting aggravated with me because I don't know if he thought that I was lying, or I don't know what the heck he was thinking. But I'm like, this ain't working. So they ended up taking that out and doing another one. The second epidural still didn't work. Same thing. I was numb on one side and I was feeling everything on the other side. At this point, I'm having the contractions. Like, I'm crying, I'm hollering. Chris is in there, my sister is in there, and I mean, it was just like, when they say, because I kept asking, like, how would I know that it's time to push? Like, when will I know? And they were like, oh, you know. But I wanted to know exactly when, you know. And the nurse was like, when you feel like you gotta take the biggest poop of your life, that's exactly how it feels. This one midwife came in, and I think she was a midwife for like many years, and then she started working at the hospital, which at that time I was working at that same hospital, so I knew the whole staff. And she came in and she had me put my legs on the table. She had me doing some freaky deaky poses, and oh my god, it worked, because as soon as she did that, my cervix went to 10 and I was ready to push. I actually cried and hugged that lady because I was like, God sent you to me. So I'm ready to push. The epidural is not working, 2 doses and it's still not working. I'm in so much pain. I felt like I was about to have the biggest poop of history. And I start pushing. Chris, on the side of the bed, looked, and I don't know what he saw, but he looked and he was like, yeah, I can't do this. So they were like asking him, are you okay? Instead of focusing on me, they're worried about if he's gonna pass out. So they had him sit down because I guess he couldn't see what was going on down there. So then I had her. So it was like 2 days after they induced me that I had her. So she was healthy, you know, perfect. Everything is good. All right. We're about to go home, and my blood pressure started going up. I didn't feel anything. I was fine. I'm happy. I have my baby girl. All is well. My blood pressure kept going up. So they were like, okay, we're going to monitor that, because I never had any history of blood pressure before. My family had blood pressure, but I was fine. They're like, okay, we're going to monitor that. it just kept going up. They had to keep giving me a bunch of medicine, so I couldn't even breastfeed because it happened so fast that they had to give me like emergency blood pressure medicine to bring it down because it was so high, and those medicine could have, you know, affect the baby. So I had to what did they call it, pump and dump. So I had to pump and then pretty much dump all the milk because I couldn't give it to her. So I was doing that, and of course, you know, when you're pregnant or when you just give birth, your breasts are like full of milk, so I had to just keep pumping. Finally, after that part was done, my blood pressure was kind of going down, and then they were like, okay, you can go home. We had our bags packed and everything, ready to go home. I'm laying there, I'm fine, still doing fine, no symptoms, I don't feel dizzy, nothing. They come in to check my vitals one last time before getting me discharged. They look on the monitor and all my vitals like were out of whack, which I don't even know how the thing didn't start beeping, because usually when stuff go up or down, the monitor's supposed to, like, you know, beep. My blood pressure was like in the 200s over like the 100s and something. Like, it went through the roof. So now they had to give me emergency IV blood pressure medicine. I think hydralazine or something, I don't remember, to like drop it. So of course now I'm like, crap, I'm not even gonna get to go home because of all this mess. So once they give it to me, it dropped, and I don't know if it was just me, because when I told the nurses that, they're like, that never happened to any of their patients. But when it dropped, my chest started hurting, and I told them, and they were like, okay. And because I work, well, I won't say because I worked there, they ordered a CT, but after I told them my chest hurt, they ordered a CT of my chest, and I knew the guys that were in CT when I went down, but they were all just like so quiet. Like, after they did the exam, like, we were talking before, and then once they did the exam and was getting me ready to go, like, nobody was saying nothing. So I'm like, okay, well, obviously I know something wrong if y'all were talking and now nobody's talking to me. What the heck is going on? And of course, they keep telling me anything. So I waited. I get back to the room, like 2 or 3 doctors came in, and they were like, I'm not gonna go home today. The CT results came back, and they showed that I have multiple pulmonary embolism in both my lungs, blood clots in my lungs, and what? At first, like, honestly, at first when they told me, I was like, oh, okay, guess I ain't go home. Like, it didn't register at all. Like, I don't know if I was just still in awe of the whole pregnancy. Oh, let me go back. So apparently there's a thing called, what was it called? Jesus. I think, wait, I don't remember exactly what it's called, but it's some kind of syndrome. But when I was leaving Ariel to go get the CT test done, or was it? No, scratch that. So I got the results. So now they have to put me on blood thinners. Yes. And the type of blood thinner that they had to put me on, I had to go to ICU to get that, because I think it was like, I don't think it was Coumadin. I think it was heparin drip that I had to get. So I had to go to CCU, and because ICU, and because ICU is the intensive care unit, babies weren't allowed to go. So when they told me that I had to go, and they don't know how long I'm gonna be up there, and the baby can't go and she can't visit, I started bawling. I mean, you would have think I was going forever. Like, I don't know, I just started crying so hard, and they were telling me that it's some kind of syndrome, separation syndrome, where when you separate, like people freak out. So they told me that, oh, it's okay, it's just your hormones all over the place, blah blah blah. So I end up going to ICU. I was up there, they put me on heparin, and I remember I think I was in the shower and I was alone, and it just dawned on me, like, oh my God, I could literally I could die like right now. And I just had my baby girl. I haven't seen her in a few hours, and I could die and not ever see her, because the clots could go to my heart, you know. And I just broke down, and, you know, Chris, like, he didn't even know what to do, because we never had kids before, and now he's gonna have to take home a newborn, and I'm in the hospital. So of course, you know, he I'm sure all his emotions were all over the place as well. So they discharged Ariel and said that she's fine, so she can't stay at the hospital anymore. So I was pretty much there by myself, and Chris had to go home with her, and, you know, his struggles. Hopefully one day he can tell his story of how it was the first night, or you know, at home with a newborn, because that was not the plan at all. I'm home, guys, but I'll finish my story. So Chris is now home with Ariel. I'm still in the hospital. I was in there for like, I think 2 weeks total. Once I got discharged, then I had to do what is it called, a check of my blood levels, like every week. I had to prick my finger for them to check my PT and INR every week. And then I did that for 6 months straight, and then after 6 months I got another test, the CT test done, and I was cleared. Now this whole thing, I mean, they told me that I can get pregnant again, and it could possibly be a healthy pregnancy, but I'm automatically high risk, and because that happened, I can develop clots again, because I had no family history of blood clots. I'm the only person that I know of that had that. And the reason why I said it's my testimony is because, and the doctors, you know, they told me this afterwards, they said all their patients, like, they've never had a patient that they've given the hydralazine, the blood pressure medicine, and it caused their chest to hurt. So it's just crazy that the day that I was about to go home, my blood pressure went up, and the blood pressure medicine, or maybe, I don't know, the clots caused my chest to hurt. I don't know what, nobody can figure it out. But just that day, you know, when I was about to go home, my chest started hurting for them to do the CT. If they didn't do the CT, I would have gotten home, and, you know, I could have possibly died, because I would have multiple clots in my lungs, and they could have went to my heart or my brain, who knows, you know. And the thing is, I didn't feel like no pain. I mean, I felt normal. Even when my blood pressure was high, I didn't have a headache, I didn't feel dizzy, nothing. Like, everything felt completely normal. So that would be the last thing that I would have thought of. And they were doing a bunch of tests to see, like, you know, why I developed them or how I developed them, and to this day nobody could tell me. They did a bunch of genetic tests, and they all came back fine. So it's just a weird thing that happened. But now it's like, I want to have another child. Chris wants us to have another child. Ariel wants a sibling. But it's kind of like, okay, do you want to have another child and risk not being around for those 2 kids, or risk not being around for your one that you already have? Or do you want to just have, you know, the one you have and you're here for them? So it's a very complicated, you know, honestly, I'm just really nervous, and I know I have the favor of God over my life and over our lives, but I just don't want to make the wrong decision as far as, oh, you know, I want to be greedy when God already blessed me with, you know, Ariel. So my sister just walked in. I'm vlogging, girl. So I don't know. All right, guys. Well, she interrupted. You want to come say hi? You want to come say hi? There she is. Wow. That's her. That's Diana. So that's my story, guys. I know a lot of people have dealt with situations during their pregnancy and after their pregnancy. To this day, I have high blood pressure still. I'm on medication. Thank God I'm down to like 1 medicine with the lowest dose, and my blood pressure has been fine every time I go to the doctor's office. So that's like a blessing, because at one point I was on like 5. So I'm just happy, and hopefully one day I'll be completely off. As far as like with the clots, I haven't had any issues. I've had CTs done before and they were all negative. The only thing is I can't get any like hormones as far as like birth control, because that will enhance, you know, increase the risk of me getting clots again. So I have to have like special birth control, and it's just been a journey, but I am thankful that I am here. I am blessed. My family's healthy. We're all okay. And yeah, so I hope you guys like my story. I know it's a very, like I said, it's very sensitive, and it's very, you know, close. It means a lot to me, and it's close to me. And we didn't tell a lot of people. Even when I was in the hospital, he just kind of sent a message out saying that people should pray for me, because we're always so private. But you know, things that happen in people's life, and when you share it, I feel like it's a blessing to someone else. You know, someone can be in the same situation and they're scared, and you know, I just want to tell you that, like, just pray. Like, we were praying. I mean, we had the church praying for us. We had family praying for us. Like, it was just, it was a tough time, but we got through it, and I'm healthy. I'm here. All right, guys, so I'm getting emotional thinking about it, so I'm about to go. So I thank you guys for listening, and I hope you like this video, and you know, have fun with your family, and just be thankful and grateful every day, because you never know what can happen. All right, guys, bye.